We're so excited to have Lindsay Gayman back with us today. Lindsay is a medical cannabis advocate, medical cannabis healer, medical cannabis educator, and a consultant. And today, Lindsay, I'm so excited about this subject. We're going to be talking about the safety of medical cannabis in children, which is quite a contentious issue.
It certainly is. Thank you very much. It's lovely to meet with you again to have a chat. And I think this is a really important topic that needs to be discussed across the board.
We've got to, there are a lot of, we discussed previously that there are so many benefits and so many uses for cannabis. Mm-hmm. And of course, when it comes to our children, we want the absolute best for them. But because it's been sort of put out there in the world as bad for you or a bad thing or a drug, an addictive substance, an illegal substance, of course you sort of think, I don't know if I want to give this to my child.
Sure.
So where would one start? If you're looking at cannabis for children, which sounds quite incredible as it is.
It really does.
Let's chat about the types of things you can use within the cannabis range for children.
Absolutely. I think going back just a little bit, though, I think helping parents demystify or unmystify their preconceived notions of already what this cannabis is, right? Because if they're looking at it, it's a drug, or how they've been brought up is going to carry over in how they make that choice for their child. Yeah. Most often it's CBD that's prescribed to children. And you'll see ADHD, you'll see different autisms, especially seizures, that this plant in CBD specifically can help with.
Okay, so it's CBD, obviously, we're talking about. I would assume that there wouldn't be any THC in any medication.
Yeah, in most cases, no, there's not. And if there is, it's very, very small. It's just trace amounts that you're going to see. And I mean, the mind of a child, I guess, right into early adulthood, our brain isn't fully developed until we're 25 years old. So keeping that in mind and keeping very minimal THC, this isn't how it always goes in the recreational aspect of it. But with the medicinal, there are some indications that indicate, a bit of THC coming on board, especially for the children who are going through chemotherapy and going through aggressive treatments to help manage that pain effectively. And THC is very much that one. It's going to help significantly. And you can also do a THC and CBD like a 1-to-1 ratio, so they don't experience any of the effects of THC. But it's rule of thumb, no THC. A lot of physicians are taking the standpoint that no THC until 25 and over.
Well, 25 is quite old, considering, as you said, the recreational aspect. Chat about what are the possible implications if a child is taking, let's talk teenagers now, if they are recreationally taking cannabis, what are the implications on their brain?
Yeah, and I think we have a ways to go with the implications because cannabis has been in prohibition for so long. So we don't have a significant amount of research of what the long-term use of THC is going to do to, let's say, in the teens or adolescents. It could exacerbate, though, pre-existing mental health difficulty. It could add to it, actually making it worse for an individual. And I don't know necessarily that it's used in the appropriate manner. For an example, where they go out to go, let's say, partying one night and they smoke themselves silly. Yeah. And then the following day, they have to recover. It isn't necessarily a daily usage as we would see in the medical community, where there would be specific dosing.
That would be a controlled thing for a specific thing and specifically for that individual. So Yeah. Okay. I hear what you're
Yeah,
saying.
and that's why we need we need the treatment plans to go along with it. So we're making sure we're covering all the bases and that it's fully transparent. So if there's pre-existing mental health difficulties or if there's liver disease, we want to take special note to those things, especially with children and even adults, because there's contraindications to use. There's a wave of thought with the mental health issue or mental health schizophrenia, to use or not to use. So they've gone more the CBD way with no THC. Yes, sorry. Go ahead.
I guess as the years go on and we begin using cannabis, medical cannabis in various aspects, we're going to learn so much more. So perhaps
Absolutely.
that in 10 years' time or so, we'll have case studies, we'll have teenagers perhaps who've used a medication with a bit of THC, and they're going to be able to say on a daily basis, oh, this is making me feel like this, and this can be adjusted according to their individual needs. And then you're going to get more research. So at the moment, I guess what is safe to say is CBD is most definitely safe with children.
Absolutely. Yeah. It's showing a lot of significant evidence that it's very safe across the board in symptom management in our children. Parents need a lot of education then, and making that informed choice for their children. And that takes a bit of time.
ADD is, or ADHD is almost epidemic.
Oh, yeah.
I'm not sure if children are being diagnosed more or if children are suffering from ADHD more. Not sure what that is. So what can CBD treatments do for an ADHD child?
Slow them down. Okay. You can look at some of the medications that are prescribed for our children. There's a whole gamut of them, actually, Ritalin being one of them. But, even it's a very unsafe drug, and then it can be used for a lot of purposes after that. But what CBD gives the opportunity for a child with ADHD is to just calm down, slow down, and it allows them to focus a little bit more. And I mean, there's various cases of ADHD. It can be very, very small, or it can be a very gigantic presence in a child's life. So that dose, we're still in that gray. So it's not a one size fits all. So it's played with most of the time until they reach that therapeutic dosing. But I would say parents would probably like listening better. The focus is there. You could even see possibly in their school studies an improvement.
Okay, so listening and focus, I mean, that's absolutely essential for children's education, because I mean, that's the biggest problem is they really battle at school because
it truly is. Yeah, and it's exhausting actually on teachers. It's not exhausting. I mean, they take the education and they're there for that purpose to understand. But it really does help the child. I can't imagine how the child's mind actually feels. How they're thinking, and they don't know any different. They're just responding and acting of a process that's going on within them. So being able to just alleviate that, it'll help them sleep better, which then gives them a better consistency. Those routines will start.
Yes. Yeah. And less stress on the child, completely less stress on everybody all around, the teacher, the parent, and the child. How is that taken? Is it usually taken in drops, or is it
for the most part drops? Yes. Yeah, absolutely. Drops. I mean, I can't see there's drops that are out, there's capsules that are out now. In Canada, and every country is slowly moving towards, as they approach medicinal cannabis, it's going to be different. Some countries, sprays is what they want to use. I've even seen, I'll leave that one to when we get to that one. I was going to say for seizures, they rub the CBD balm. They make a balm out of it, but they rub it on the soles of the feet, and it to minimize or to take away that seizure. So, yeah,
that's very interesting. Okay, so there is a balm on the soles of the feet. That's fascinating. How quickly does it work? Do you know?
Yeah, very, very, well, I don't know exactly the specific times, but very, very quickly. There's a wonderful documentary about the Stanley brothers, who essentially, to make a long story short, they grew CBD and they didn't know what to do with it. And the other side of it, they had Charlotte. These two parents had a beautiful girl, Charlotte, but she was having up to 300 seizures a day.
Oh,
and they were at their wits' end. They didn't know what to do. So they did some research and they actually approached the Stanley brothers if they could use some of the CBD. And almost immediately her seizures started to stop. And then her development started. It was absolutely amazing. I forget which documentary this is actually under, but that's how Charlotte's Web actually became Charlotte's Web. The CBD strain is from this little girl. Yeah.
So interesting. Okay, well, I'll have a look and see if I can put a link on this podcast as well to that documentary for anyone
It's excellent. Yeah,
who's keen to see it. Now, just in terms of autism, how does CBD help as well?
Yeah, CBD allows too with autism. There's various secondary things that are happening. So you're seeing seizures. You're seeing sometimes what's the word I'm looking for? They can't take food orally, so they're fed through a G tube. So it looks different for every little being. So CBD again, it is very as an anti-anxiety, to diminish those seizures, I don't know necessarily, it depends on the case how critical it is, but it's that calming effect again.
Okay, that's fabulous. So once again,
And
I'm going to repeat once again that this CBD is very safe for children.
It is incredibly safe for children. Yeah. And, it does have to be clinically followed. And there has to be, like I said, transparency with the healthcare team. And the parents need to feel comfortable in administering, CBD. But even from the hemp plant, you can get more of a full spectrum, which means that there's more cannabinoids in it. In the preparation that could yield more, like a significantly better effects. But it's helping the parents through that process and getting them to that point.
So once again, and this is your mission, Lindsay, is educating the medical community and educating the end users on the safety aspect, and also really how to diagnose or how to dose, and how to really look at each individual case.
It is an individual case, yes.
And then understanding the effects of, you've just mentioned that hemp yields better results than...
Well, the hemp is actually, not to take up too much time, but hemp is very, very interesting plant that has virtually no THC in it, but it's an abundance of different cannabinoids, and it allows for something that's called a full spectrum that people are finding very therapeutic. It's becoming a lot larger. Hemp is legal in numerous countries as opposed to cannabis sativa. So there's a lot of research to suggest that the full spectrum, even CBD isolate from the plant, their various applications are very effective.
Okay, great. So I'm going to ask you a personal question. Do you
Sure.
give your son CBD for any reasons?
Actually, you know what? My son has shown signs of broad spectrum Asperger's.
Okay.
And he does have a problem with attention and focus. And absolutely. Very small doses. I tried to exhaust all measures, used melatonin and passion flower, and this just gives him a little bit. He doesn't need much, but it just gives him a little bit to just help take that pressure off of him. It's like night and day, better sleep, better eating, looking at all of it. So yeah, I do. Absolutely. And he understands it to be a medicine as well, not a drug. That's the difference.
Yeah, well, absolutely. Because he has an informed mother. He has a lot more informed parents. And it really is. It takes informed parents to start speaking to medical practitioners and saying, "This is what
Mm-hmm.
I want. I don't want the pharmaceutical stuff. I want something
Yeah.
from nature that has been
Mm-hmm.
proven to work." Um,
Yeah.
and once again, we'll get more and more case studies coming out where people can really just dig deep into it. I mean, there is a lot of information out there already about cannabis.
Yes.
Um,
Yeah.
and in fact, so much so that that's why we're really glad to be talking to you, because we need to find the absolute correct source of information.
Absolutely.
Um,
Yeah. You want reliable, effective. Yeah, you really do. You look for credibility. That's what you need to look for is credibility.
are there any very specific things or any messages that you would like to get out there for parents and for medical practitioners when it comes to child safety and CBD, or do you think we've covered it?
I think when it comes to the medical profession, I think we have to meet kind of in the middle. I think they do bring up some very, very good points that have been quickly dismissed. So I think there has to be the meeting of minds. There has to be some dialogue that starts because it isn't happening right at the moment. And possibly listening as opposed to laying that judgment very, very quickly. You know, doctors or healthcare professionals are very evidence based. So that's why research is so essential. And for parents, it's their right to empower themselves through knowledge to make these informed decisions, whether it's here and now or down the road, or how to help, let's say, their adolescent, and having these open conversations. My son had his first conversation about cannabis when it came to my mom. She was using medicinal marijuana or cannabinoid therapy for her. She had ALS, and that was his first exposure. And I didn't hide that from him because he needed to see that. So yeah, we need to protect our kids, but we also need to let them see it as a medicine, and parents can do that through just simple education.
Well, I guess, as cannabis becomes more on the open market and more accepted, it's going to be,
Mhm.
we all know teenagers love to do the thing they're not supposed to do. Um,
Yes, you're right.
Be interested to see if there's less and less of the recreational taking of cannabis, because it's now becoming
Mm,
mainstream. So it's no longer always
sure.
exciting, and rather using it as, in the way that it should be used.
Mm. And
To chill or wake up.
yeah. And there is the flip side of it too. Parents do have their own accountability in it too. If parents have their own medicinal, their own, it's looking at the safety of the child so the child can actually access it.
Yeah.
It's keeping it up, keeping it away, even from pets too. It could cause some serious things, but especially with edibles and concentrates and all these things, it's parents keeping a good handle on where it is at all times, really locked and put away, so that curiosity is gone too. I suppose that would be the other side of it.
Yeah, well, I mean that's the same as for a paracetamol.
Mm.
Keep
Hmm.
the medicines locked up and in a safe
Yes.
place so your kids
Yeah.
can't get hold of them. Absolutely,
Yeah.
100%. Great, thank you so much, Lindsay, for that chat. I think we've gone a little way in letting people know that
Mm.
CBD is safe for children. It's got some amazing effects on epidemic ADHD that's around the world,
Mhm.
autism, seizures. I find that absolutely fascinating. Just a balm on the bottom of the feet. Um, Asperger's, all the children maladies that sort of seem to be quite popular, not popular. They're coming out.
No, but they're becoming more common. They're coming more mainstream. These conversations are finally starting to get talked about. I think there was a lot of stigma that went around not to talk about some of these things, or you just kept it very, very quiet. Now people are starting to say, yeah, hey, so it changes things. So it's always been there, but they are growing. Unfortunately, these epidemics, they're sizable. So we need to be listening and trying to help.
Well, I think, yeah, the mental health conversation is becoming more mainstream. People aren't
Mm-hmm.
necessarily anymore too scared to say they're in therapy, or my child has got an issue, or whatever it is. We are much more
Mm-hmm.
open to that. So hopefully,
Yeah.
being open to talking about it, we can then become more open to a natural solution such as CBD.
Mm-hmm.
Um,
Absolutely.
marry those two. Great. Thank you
Mm-hmm.
so much, Lindsay, for chatting to us.
Thank you.